So it's great. I was just numbing patient right now. This is beautiful Dawn. This is actually, I want to introduce Haley, my wonderful nurse here at Glow Derma. We've been mentoring, well, I've been mentoring her for the past almost 3 years, right? And this is her gorgeous mom, Dawn, that we will be working with today. I just wanted to go over placement. I'll be doing a hemi face and then finishing off camera for her left side of her face if you're looking at the camera. And Dawn, would you mind just sitting up slightly? So some history about Dawn. You've been a patient of mine now for about 7, 8 years?
Yeah.
Probably 8. So she is gorgeous.
Oh, thanks.
We met at the gym, hence why now Haley's one of our amazing nurses and everything. So she's been taking exceptional care of her skin. She's at Sculpture. It's been a while. She did have threads about, I guess, 2.5 years ago or so.
Yeah.
Wasn't the best experience for her. So thank you again for being one of my models for this live demo. No pressure whatsoever. But I just want the camera to zoom in. I marked the left side of her face just so you can see the placement and the why behind it. And then as I'm going through the actual live demonstration, please feel free to go ahead and ask questions because I love it when people are throwing questions out as I go along. I'll be keeping the threads in today during the demo in order for you to see placement, depending on when you did come on and to see this. But we're going to start, I always start from the back to the front. So we're going to do twist threads, 29 gauge twist threads. The reason why I chose twist threads for this whole procedure is because we want it to anchor. So if you're looking for a proper vector that's going to give her that brow lift, not that she needs too much, you want to cross hatches here. So you start in the lateral brow, and I like to go in right above the zygoma and more or less go back towards the hairline in order to give her that beautiful lift. So as the twist, think about it like a corkscrew. The collagen is being created. I'm just gonna lift your, yep, perfect. Being created, it's going to stay like that as far as, even though the thread is being reabsorbed, the collagen stays there, and that's more of like that anchor. So I like the visualization of using a corkscrew like that. So this is gonna help elevate this. I want to also start this off that we did pre-treat Dawn's face with EzGEL PRF in all the areas that we are going to be putting the smooth and twist baby collagen threads in tonight. So I did already put a little bit in her temples, her preauricle. We will go ahead and move down. I think about it as like almost like a spider web. So if you think about underneath the skin as the collagen is being recreated, it's going to almost like web and support that skin to elongate her jawline and keep it up. So I do it in a 8 formation of the smooth threads because we don't need to anchor that necessarily. We want that collagen and the elastin support superficially underneath the skin to help web this up, just like a spider would if they're creating a web. Now we move to the mid-cheek junction. So here, she doesn't really have too much fat pad distension, but we want to prevent that from happening. So if we can just recreate that here in a 4 using a 29, 1.5 gauge smooth thread, that's going to help elevate this and again recreate that illusion and also the actualization of collagen and elastin formation caused by these threads. If we move up here, if you can look right into the camera, Dawn, that would be great. We're going to use a little bit more of the twist threads because we want this to anchor to help support it. So if you just think about the ease of this, if you know where to go as far as the blueprint, you can then recreate it and customize it to whatever your patient needs. Many times in the kits, I love the blueprint because that was always something that was difficult for me as far as how many threads do we need? How do we go ahead and estimate like the cost of these things? Well, now we have the blueprint in these kits that we're able to say, okay, here we are. These are the areas we want to recreate the collagen. It makes it easy. And then after that, you can customize it to whatever you need using individualized threads. Then we move down to the pre-gel and the chin shadow. And we just want to offer a little bit of support. Whenever I'm deciding also if I need to add additional threads in addition to the BabyGLO kit themselves, I like to pinch the skin, see where the integrity is. You can see that her skin has been really well maintained. And these threads are all going to be superficial. So again, if you think about anatomy and how that's concerned, we're avoiding any sort of vessels. We are above this mass. We're not going to cause any sort of occlusions whatsoever. Temples, we're in layer 2 to give it that support. So it's slightly deeper because that's what we need to do in the temporal area and the fascia. So let's get started. Lower her down a little bit. If anyone has any questions during this, please shout it out. Cheryl is here as the MC.
I already have some questions.
Okay, great.
How do you decide between using sharp versus blunt threads?
Sharp and blunt. So you can use both. They both work the same. I'm going to start with the preauricular. The reason I'm starting with the preauricular in this case is because Dawn is a clencher and we have not treated her temporalis muscle. So I like to let this relax a little bit since we just injected EzGEL PRF because it can get very, very tight in this area. So making sure that patients know that's what it's doing. It's doing its good thing, but it could be a little bit uncomfortable. So I'm going to actually do that last as far as our BabyGLO technique tonight. But we'll move back to that as well since she's been pre-treated with EzGEL. When it comes to blunt or sharp, it really doesn't matter. It's completely up to the provider, what their comfort zone is. Quite honestly, I was always a sharp kind of girl. And then I tried the blunts and I also love that as well. But for demos tonight, we're gonna be using all sharp. But both, it's kind of up to you with what you're comfortable with. So again, we're gonna start in the preauricular junction. I'm gonna have you just turn slightly so the camera can see. I'm gonna start right back here by the tragus. And again, I'm creating this nice, beautiful webbing effect. Patient has already been numbed, treated as she was getting her treatment. See how I just glide? I'm above the parotid, so I'm not interfering with any sort of anatomical positioning below it. And this is where the fun part starts because you can actually see how my non-injecting hand is supporting the tissue up. Gives you a little bit more of that advantage in order to really get that support.
That's 4.
Perfect. So we're gonna put 8 here of the 29 1-inch. How you doing, Dawn?
Great.
See how I get little to no restriction whatsoever. It should glide like butter. I'm a righty, so I like to come on this angle and see where that vector lays in order to get the maximized support given. Go, perfect. And we're gonna keep the threads in for tonight just for training purposes. Typically, I do remove them shortly thereafter, but a big thing to note is look at what my non-injecting hand is doing. I'm always elevating the tissue with it. So when you do it, it gives it a little bit more of that ease of gliding and also extra support. And this is the last one.
Amy, another question. When do you decide to combine BabyGLO with a regenerative injectable like EzGEL?
Oh, it's amazing. Well, I prefer doing it both together, but you can absolutely do it as a standalone treatment as well. My patients have already loved EzGEL for quite some time. So now it's just like adding in those threads. So if you have a patient that might have started their sculpture or any other, bioregenerative treatment, you can add these in or use it as an adjunct. A hot thing right now is stacking different treatments together to save time so that everything is on the same wavelength of one another. And so I find that especially like my out-of-town patients, they just want to recover all at the same time. Now we're going to move to the nasolabial folds. One of my favorite trifecta, if we want to use that, I would do Sculptra Deep. We didn't tonight because she's a little overdue, but we decided just for tonight that we'll do that at another time, which is nice because it's all customizable.